Welcome back to STL Live. I'm Sarah Bernard, and my guest is Dr. Dwight E. McLeod, who is the Dean of A.T. Still University, Missouri School of Dentistry. Welcome back. We've been talking about the amount of training that dentists, our students today who want to become dentists, the number of years. And it's a growing profession. We need more dentists. And they can get their training right here in St. Louis. So you were talking about the clinic that's right here on Park in Lafayette Square, where people in our community at all income levels can go to get dental care.
Exactly.
Yeah. So talk about the students who are working on the patients and the kind of faculty supervision they receive.
Great. So we have our year 3 and year 4 students in the clinic, and they're supervised by trained, well-competent faculty members, general dentists, and or specialists. And they're well supervised. So our goal is to make sure that they have everything that is necessary to produce well competent graduates, at the same time serving the needs of our community by giving our patients the care that they need. And that's our focus. And also, one of our emphasis is to make sure that those graduates are very sensitive to the needs of the community. So in addition to getting a MD degree, they also get a certificate in public health. Because we want them to be leaders in the community. We want them to know that there's a great need for dental care in the state of Missouri and elsewhere. And actually, we want them to go back in the areas that the needs are greatest.
So would you say that is a focus of A.T. Still University to have graduates working entrenched in the community?
Exactly. So in addition to being trained at the St. Louis Dental Education and Oral Health Clinic here at 1500 Park, they actually go out in community health centers across the state of Missouri and in some other states, and they spend 16 weeks in those areas. And typically those community health centers are in areas of need, in underserved areas, and that's what we want. We want to make sure that we are addressing the needs of the people here in Missouri and elsewhere, and we want to make sure that we help reduce the disparity that we see in oral health. And another goal of A.T. Still University is their focus is on total body health, and this is in line with their osteopathic mission. And that's exactly is important, because we know that what occurs in the mouth, any diseases such as periodontal disease, can affect total body health, and we want to make sure that we're really treating the entire body.
So having good dental care can also, you could get a heads up on things that are going on in your system that maybe you don't know about.
Exactly.
Yeah, it's kind of a first look.
Yes.
Yeah, so it's important.
It's important. Yeah.
So the dental, the industry and oral health care is constantly evolving and changing as you learn new things, we all learn new things. What are some of the hot topics right now?
Oh, great, and this is an important question. There's so many technologies that have come about since I've actually finished my dental education. We have 3D imaging. That's very important. We have CAD/CAM technology, or CERAC, where a crown can be milled right there at our facility. Implant dentistry is big. Our root canal specialist, not that we have a root canal specialty program at the school, but in all the different areas in dentistry, the technology has been so amazing that it makes dentistry affordable, it makes dentistry more contemporary, and it's a very attractive field that brings a lot more people into dentistry. And yes, definitely we're glad that that's happening, because there's a big need.
Yeah, absolutely. Yeah. And so going back to the clinic at 1500 Park, the rates, are they reduced rates because it's a training program? How does that work?
Oh yeah, definitely we have discounted fees, we take Medicaid, we take most private insurances, and our goal is to cater for everyone. As I mentioned, those that can afford treatment, those that can't, such as the underserved, the uninsured, the underinsured, and the working poor. So that's part of our mission, is to make sure that we have affordable dental care for all the people in St. Louis and around the state. And that's why we encourage our graduates to go back and practice in areas of need.
And you've taken groups of students yourself to Jamaica. right?
Yes,
Yeah,
definitely.
to do, and you've treated, we were talking about this off camera, over 17,000 people in Jamaica. You've been treating with the groups that you've taken down, which is phenomenal. Are you going to continue that this year at
Oh
AT
yes,
still?
and as a matter of fact, our students are eager to participate in that next July. They're looking forward to it, and it's going to be a great experience for them. And it's going to be another way to serve the community, serve the underserved.
Absolutely.
Yeah.
Well, thank you so much for joining us, Dean McLeod. Welcome to STL Live again, and we look forward to hearing more about what's going on at 1500 Park at the clinic. So for more information on AT Still University, Missouri School of Dentistry and Oral Health, call 314-833-2700. There's more STL Live after this. Stay with us.